If your hands feel like ice, no matter the season, if your toes tingle or go numb during a walk, or if your ankles puff up by evening, please listen closely. Those are not just annoyances of getting older. For someone over 60, they are often the first signals that blood isn't getting where it needs to go. I'm Dr. Richard Coleman. In my years as a geriatrician, I've seen these signs precede serious problems, and I've also seen how small, consistent actions can make a meaningful difference. Today, I want to show you one simple cup you can add to your morning routine that can support circulation, plus a 5-minute movement routine that multiplies that benefit. If this speaks to you, drop your age and country in the comments. I'd love to hear where you're watching from. It matters because circulation problems are common and under-recognized. The American Heart Association estimates peripheral artery disease affects over 8 million Americans. Poor peripheral circulation doesn't just make your hands and feet cold. Left unaddressed, it increases the chance of pain with walking, wounds that heal slowly, and higher cardiovascular risk. I'm not saying this drink will prevent every complication. What I'm saying is, this protocol is a low-cost, evidence-aligned, biologically sensible intervention that many patients find helpful when used responsibly and in coordination with their clinician. Let me explain why circulation declines with age. In plain terms, blood vessels are not static pipes. They are living tissue that needs to relax and contract appropriately. One key player is nitric oxide, a tiny molecule that tells blood vessels to relax so blood can flow easily. As we age, our bodies produce less nitric oxide. The lining of the blood vessels, called the endothelium, can be damaged over time by persistent low-grade inflammation, a process some researchers call inflammaging. Think of inflammation as a kind of biological rust that stiffens the plumbing. Add to that a slowing thyroid in some older adults, weaker little valves inside the veins that help blood climb back to the heart, and the cumulative effect is sluggish flow and pooling of blood in the extremities. The result? Cold, numb, swollen feet or hands, and a higher risk of clots or poor wound healing if nothing is done. We can't replace every failing mechanism overnight, but we can target a few of the most important, and that's where the one simple cup comes in. This is not a miracle cure. It is a focused morning beverage designed to supply dietary nitrates and antioxidants that help the body make and protect nitric oxide, combined with ingredients that reduce inflammation and gently promote blood flow. Taken on an empty stomach and followed immediately by 5 minutes of gentle movement, this cup becomes a biochemical and mechanical nudge to restore warmth and flow. Here's the clinical rationale in a sentence. Beets provide dietary nitrates that the body converts into nitric oxide. Pomegranate offers polyphenols that help protect nitric oxide from oxidative damage. Ginger and turmeric blunt inflammation and have mild antiplatelet effects. Lemon supplies vitamin C, which supports vessel health. And coconut or purified water gives you hydration and electrolytes to help blood volume and flow. Combined, they target production, preservation, and mechanical delivery of blood to the extremities. Many patients report feeling a marked warming of hands and feet within 10-30 minutes after starting this routine, though individual responses vary. Now I'll give you the exact recipe I recommend clinically, step by step. Follow the safety notes I'll lay out afterward and start slowly as I recommend. You will need 1-2 cup fresh beetroot, roughly chopped, about half a small beet. 1 tablespoon pomegranate seeds or 1 tablespoon pure pomegranate juice, unsweetened. 1 teaspoon freshly grated ginger, or about a thumb-sized piece grated to equal 1 teaspoon. 1-2 teaspoon turmeric powder, or a 1-inch piece of fresh turmeric root grated, either is acceptable. 1 teaspoon fresh lemon juice, about half a small lemon squeezed. 1 2-cup coconut water or purified water, no added sugar. If you use coconut water, the electrolytes are helpful. If you are very sensitive or trying this for the first time, start at half this amount for 3 to 4 days. Use 1/4 cup beetroot, 1-2 tablespoon pomegranate, 1-2 teaspoon ginger, a scant 1/4 teaspoon turmeric, or a small scrape of fresh root, 1-2 teaspoon lemon, and about 1/4 cup water. This gives your digestive system and your clinician a chance to assess tolerance. Preparation steps. Use fresh ingredients when possible. Fresh beets, pomegranate arils, fresh ginger and turmeric are ideal because they have higher concentrations of active compounds and more vibrant flavor. If you can't get fresh turmeric, a high-quality turmeric powder is acceptable. 2. Peel the beet if the skin bothers you. It is not absolutely necessary. Many people blend the beet whole after scrubbing. Chop into chunks that will blend easily. 3. Add the beet chunks, pomegranate seeds or juice, grated ginger, turmeric, powder or fresh, lemon juice, and the half cup of coconut or purified water into a blender. 4. Blend on high until smooth. If you have a sensitive stomach or are prone to reflux, strain through a fine mesh sieve or cheesecloth to remove pulp and reduce bulk. The liquid contains the majority of the nitrates and polyphenols you're after, so straining is fine. 5. Drink this cup first thing in the morning on an empty stomach. After finishing, wait 20-30 minutes before breakfast. This timing gives your body a clean window to convert dietary nitrates into nitric oxide and to allow the anti-inflammatory compounds to begin circulating. 6. If you tolerated the half dose for 3 to 4 days without issues, move to the full recipe above daily. Many patients find daily use is most effective, but you should discuss frequency with your clinician if you are on specific medications. Why these exact ingredients and amounts? Let me unpack the role of each so you understand the how and why. Beetroot. Beets are one of the richest natural sources of dietary nitrate. When you consume nitrate, bacteria in the mouth and enzymes in the body convert it into nitric oxide. Nitric oxide is the vessel's relaxation signal. When it's present, arteries relax, capillaries open, and blood can reach the hands and feet more easily. The half cup of fresh beetroot is a practical, tolerable amount for most older adults and provides a clinically meaningful nitrate load without an excessive volume of sugar. Pomegranate. This fruit is rich in polyphenols, antioxidant molecules that help protect nitric oxide from oxidative damage. Think of nitric oxide as a little whisper that tells the vessels to relax. Oxidative stress is the noise that drowns out that whisper. Pomegranate helps reduce that noise, making the nitrate-derived nitric oxide more effective. 1 tablespoon of fresh seeds or juice adds a concentrated dose of these protective compounds without excess sugar. Ginger. Fresh ginger provides warmth and a mild circulating effect. It has anti-inflammatory properties and can act as a mild blood-thinning agent. Helpful for flow, but exactly why we must be careful if you already take anticoagulants. 1 teaspoon of grated fresh ginger gives a gentle thermogenic and anti-inflammatory boost. Turmeric. Whether in powdered form or fresh root, turmeric contains curcumin, a compound with notable anti-inflammatory effects. Turmeric can reduce platelet stickiness, making blood flow more smoothly. That's beneficial for circulation, but again raises the importance of medication review if you're on blood thinners. Half a teaspoon of turmeric powder or a 1-inch fresh root piece provides a functional dose for a daily beverage. Lemon. The vitamin C and acidity in lemon help with the overall bioavailability of some compounds and support collagen and vessel structure. A teaspoon of fresh lemon juice lifts flavor and provides a modest supportive benefit to the vessels. Coconut water or purified water. Hydration matters. If blood volume is low, circulation suffers. Coconut water adds electrolytes in a gentle, natural way, while purified water keeps the drink simple for those with sensitivities. Use whichever fits your dietary needs. How fast can you expect to feel something? Many patients report a perceptible warming of fingers and toes within 10–30 minutes after finishing the drink and doing the short movement routine I'll describe. For longer-term structural improvements in vessel health and inflammation, changes may accumulate over weeks to months. That's why persistence and coordination with your clinician are important. Now, the movement part. This is essential because chemistry alone is only half the story. The muscles in your legs and arms act as pumps that push blood back toward the heart and into the capillary beds of the hands and feet. When you combine a biochemical boost to blood vessel relaxation with 5 to 10 minutes of gentle activity, you amplify circulation. The movement triggers more nitric oxide production locally in the muscle and engages the venous valves to clear pooled blood. Do this immediately after you finish the drink. Here are simple options. Pick what matches your mobility and strength. Aim for 5 to 10 minutes total, short sets with gentle effort. If you can stand and move, chair-assisted shallow squats. Stand behind a sturdy chair, hands on the backrest. Lower your body just a few inches as if you were going to sit, then stand up. Repeat gently for 1 to 2 minutes. Keep the motion shallow and pain-free. Marching in place. Lift your knees one at a time toward hip height, comfortable for you. Swing your arms as you would walking. 2 minutes of marching stimulates calf muscles, the key pump for lower limb circulation. Heel raises. Stand behind the chair and rise up on your toes, then lower back down slowly. Aim for sets of 10–15. This activates the calf pump that moves blood upward. If standing is difficult or you prefer seated options, seated leg swings. Sit at the edge of a firm chair and extend one leg straight, then lower it without touching the floor, alternating for 1 minute per leg. Ankle pumps. While seated, flex your ankles up and down, then circle your feet in each direction for a minute. This is especially useful for warming the feet and improving venous return. Seated marching. Lift one knee at a time while sitting, alternating at a steady pace for 2 to 3 minutes. Upper body options, if your hands and arms are cold. Arm circles. Extend arms to shoulder height and make small circles for 30 to 60 seconds in each direction. Shoulder shrugs and wrist pumps. Shrug shoulders up toward ears and release, then open and close hands or shake them gently to stimulate circulation. You don't need to push to fatigue. The aim is rhythmic movement that activates muscles and venous valves. Think of it as turning on the house pump that propels blood through the pipes. Now the safety conversation, which I need to emphasize strongly. This drink contains active compounds that can interact with medications and medical conditions. Pay close attention here. If you are on anticoagulant or antiplatelet medication, such as warfarin, Coumadin, apixaban, rivaroxaban, dabigatran, clopidogrel, aspirin, or similar, do not start this routine without consulting your prescribing clinician. Ginger and turmeric can have mild blood-thinning effects and may increase bleeding risk when combined with those medications. I can't adjust or advise on your dose of medication. I can only advise you to seek medical guidance before making this part of your daily regimen. If you take antihypertensive medications, be aware that dietary nitrates from beetroot can lower blood pressure. That can be beneficial, but if your blood pressure is already managed by medication, the combination can sometimes lower pressure more than desired. Before daily use, check your blood pressure within the first few days and notify your clinician if you notice dizziness, faintness, or unusual lightheadedness. If possible, monitor your blood pressure before drinking and 30 to 60 minutes after during the first week of use, so you have data to share with your clinician. Do not stop or change your antihypertensive medications on your own. If you have a history of kidney stones, particularly calcium oxalate stones, exercise caution. Beets contain oxalates, and consuming them regularly could be a concern for some people predisposed to stones. Discuss this with your nephrologist or primary care physician before starting. They may recommend more frequent fluid intake, urine monitoring, or alternative adjustments. Other important considerations. If you are on medications metabolized by certain liver enzymes, such as some statins or other commonly prescribed drugs, talk with your pharmacist or clinician. Pomegranate has the potential to interact with drug metabolism pathways in some people. This is another reason to consult before making the drink a daily habit. If you have uncontrolled diabetes, check how adding fruit juice or fruit-based ingredients affects your glucose and discuss with your diabetes care team. Allergies. If you are allergic to any of the components, beet, pomegranate, ginger, turmeric or coconut, do not use them. Substitute purified water for coconut water if you avoid coconut. Startup protocol I recommend in clinic. 1. Begin with half the recipe for 3 to 4 days to assess your tolerance. This reduces the chance of gastrointestinal upset and lets you and your clinician observe any changes in blood pressure or bleeding risk. 2. If tolerated, move to the full recipe each morning on an empty stomach. 3. Perform the 5 to 10 minutes of gentle movement immediately after the drink. 4. Monitor and document any meaningful changes: warmth of hands, feet, walking distance, swelling measurements, blood pressure readings, or any unusual bruising or bleeding. Bring these notes to your next clinic visit. 5. If you notice concerning symptoms, new shortness of breath, chest pain, fainting, significant lightheadedness, or unexpected bruising, stop the drink and consult your clinician or seek urgent care. Practical tips to make this sustainable. Prepare ingredients the night before if that helps your morning routine. Keep chopped beets and pomegranate arils refrigerated. If taste is a barrier, start with half the recipe and use a small splash of additional lemon to brighten flavor or strain the drink to reduce pulp. If beet juice stains clothing or counter surfaces, handle carefully and wash immediately. If you are concerned about blood sugar, prefer using pomegranate seeds rather than sweetened juices and keep portion sizes as listed. For storage, the blended drink is best fresh. If you must store it, keep it refrigerated and consume within 24 hours. Before refrigeration, check for separation and stir well. Fresh is best for nitrate availability and flavor. How will you know it's working? Many patients describe a reproducible pattern, a warming sensation in fingers and toes within 10-30 minutes after the drink and movement, decreased evening swelling in ankles after a week or two, improved walking comfort over several weeks if PID is mild. But remember, responses vary. For structural problems such as significant peripheral artery disease, vascular testing and specialist care are often needed in addition to lifestyle and dietary measures. Consider this cup as an adjunct, a practical, low-risk step that supports circulation and pairs well with the movement habits your clinician may already recommend. A few realistic expectations. This approach helps with physiology, supporting nitric oxide, reducing inflammation, improving venous return, but it cannot and should not be marketed as a standalone cure for advanced vascular disease. If you have ulcers, non-healing wounds, rest pain or severe claudication, leg pain that stops you from walking, please seek vascular evaluation. Use this beverage as part of a broader plan that includes medication review, smoking cessation if applicable, supervised walking programs, and regular follow-up. Let me give you a simple sample morning timeline to make this easy to follow. Upon waking, make the half or full recipe and drink it on an empty stomach. Immediately after finishing, perform your selected 5-minute movement routine, chair-assisted or standing. Wait 20 to 30 minutes, then have breakfast. If you need to take morning medications that require food, coordinate timing with your clinician or pharmacist. Record morning notes for the first week, blood pressure readings if you're on antihypertensives, any bruising or bleeding if you're on blood thinners, and a note on how warm your hands and feet feel. If you're a caregiver assisting an older adult, you can prepare the drink and supervise the 5-minute movement. Encourage small steps and celebrate small improvements. Those are the wins that keep people engaged and independent longer. Before I close, 2 quick clinical reminders. Do not stop or change prescription medications without your clinician's approval, and don't interpret this cup as a replacement for diagnostic tests or specialist care if symptoms are severe. Use this protocol as an empowering, evidence-aligned routine that many older adults can reasonably add to their life, and do so with appropriate medical oversight. To recap, cold, numb, or swollen extremities in older adults are common and often signal reduced peripheral circulation. A targeted morning beverage, half a cup of beetroot, a tablespoon of pomegranate, a teaspoon of fresh ginger, half a teaspoon of turmeric or a 1-inch fresh root, a teaspoon of lemon juice, and half a cup of coconut or purified water, taken on an empty stomach and followed by 5 to 10 minutes of gentle movement, can support nitric oxide availability, reduce inflammation, and mechanically improve blood flow. Start at half the recipe for 3 to 4 days, watch for tolerance, monitor blood pressure if you're on antihypertensives, and consult your prescribing clinician if you take anticoagulants or have a history of kidney stones. If you decide to try this, do so thoughtfully. Bring your observations to your next medical visit and use those data to collaborate with your clinician. Many older adults regain meaningful warmth, less swelling, and improved comfort with walking by combining small dietary shifts with regular movement. That regained warmth is more than comfort, it's a step toward preserving independence. If you found this practical, please like this video, subscribe for more senior health routines, and share it with someone who always complains about cold hands. Thank you for letting me walk you through this simple, clinically informed routine. Start safely, monitor closely, and let it be one small, steady step toward better circulation.